Good afternoon, everyone. My name is Lenore Hernandez, and today I'll be discussing HIV, which is human immunodeficiency virus, a significant public health issue globally. HIV is not only a disease, but a lifelong journey for many, requiring education, treatment, and support. In this presentation, I will cover the causes, risk factors, pathophysiology, signs and symptoms, diagnostics, patient education, potential complications, and most importantly, how individuals can manage this condition effectively. Let's jump in. So, first, I'd like to take a look at the pathophysiology. To understand HIV, we need to explore how it affects the body at a cellular level. HIV is a retrovirus, which means it has the unique ability to integrate into the DNA of its host. It is primarily targeting the CD4 plus T cells, which are crucial for coordinating immune responses. Here's how it works. The virus is going to attach to the CD4 plus T cells using proteins like GP120 and GP41. Inside the cell, the virus uses reverse transcriptase, an enzyme that converts its RNA to DNA. The viral DNA is then inserted into the host genome, becoming a permanent part of the cell. From there, the virus will replicate, producing new particles that infect other cells. Over time, the destruction of CD4 plus T cells weakens the immune system, leaving the body vulnerable to opportunistic infections and certain cancers. Without treatment, this leads to AIDS, which is acquired immunodeficiency syndrome, a severe stage of immune system collapse. Now, looking at the etiology, we know that HIV is caused by the human immunodeficiency virus, a pathogen that specifically targets the immune system, with CD4 plus T cells being its main victim. These cells are vital for coordinating our body's defense against infection. The virus is transmitted through several pathways. First, unprotected sexual contact, which is the most common method worldwide. Next, sharing needles or syringes, especially among intravenous drug users. It can be spread through mother-through-child transmission during childbirth and/or breastfeeding, and in rare cases, contracted through blood transfusions, especially in regions lacking advanced blood screening practices. Once HIV enters the body, it starts attacking the immune system, setting the stage for chronic immune suppression. Some signs and symptoms that you might notice progress through 3 different distinct stages, each with its own symptoms. So first we have the acute phase, which is going to be 2 to 4 weeks post-infection. A person might experience flu-like symptoms that often occur, including fever, fatigue, rash, sore throat, swollen lymph nodes. These symptoms are so common that they are mistaken for other illnesses, thus delaying detection of HIV. Then we will have the chronic latency phase. This stage can last years. Many people are asymptomatic, but the virus continues to replicate and weaken the immune system. And the progression of AIDS is also a possibility without treatment. HIV advances to AIDS with symptoms including severe weight loss, persistent diarrhea, opportunistic infection like pneumonia or tuberculosis, certain cancers such as Kaposi sarcoma or lymphoma. Recognizing these signs early is critical for timely intervention. HIV is diagnosed with accurate testing, and it's essential for managing it effectively. Some screening tests include the antibody and antigen test. It is the most common method detecting HIV antibodies and antigens in the blood. Rapid HIV tests use saliva or blood to provide results in minutes. If the screening test is positive, confirmatory tests like the Western blot or immunofluorescence assay ensure accuracy. Monitoring disease progression is also important. This can be done by the CD4 plus T cell count that measures the immune system's health, HIV viral load testing, which measures how much virus is in the blood, guiding treatment decisions. Additional testing would include screening for STIs and other opportunistic infections that often accompany HIV testing. Routine testing is key to early diagnosis, timely treatment, and better outcomes. Patient education empowers patients to take control of their health. First, a patient must understand the disease. Knowing the difference between HIV and AIDS is vital, emphasizing that with modern medicine, HIV is chronic but a manageable condition. Antiretroviral therapy, ART, stops the virus from replicating. Strict adherence to these medications prevent drug resistance and keep the virus under control. Preventing transmission is important by promoting safe sex practices like using condoms and introducing tools like PrEP, which is pre-exposure prophylaxis for high-risk partners. Discouraging sharing needles or personal items. Another way to combat this is with living a healthier lifestyle, encouraging a balanced diet, regular exercise, and stress management. Avoiding alcohol, tobacco, and recreational drugs. Routine monitoring is important. Regular lab tests, including CD4 plus T cell counts and viral loads, are essential to track progress and adjust treatment. If left untreated, HIV can lead to serious complications, such as opportunistic infections, including but not limited to tuberculosis, cryptococcal, meningitis, and fungal infections. Neurological problems, such as memory loss, difficulty concentrating, and other cognitive issues, and cancers. Progression to AIDS can also happen with advanced immune suppression, leaving the body defenseless, ultimately leading to death. These complications highlight the importance of early diagnosis and consistent treatment. Not everyone has the same risk of contracting HIV. Certain behavior, circumstances, and demographics play a role in increasing vulnerability. Some behavioral risks include engaging in unprotected sex, having multiple partners, or sharing needles during drug use. Medical risks include untreated sexually transmitted infections, which increase your susceptibility. Social and cultural barriers might, have an effect as well, with like a stigma, lack of healthcare access, or fear preventing people from seeking testing or treatment. Demographics do play a role, as there is higher risk groups, which would include men who have sex with men, healthcare workers that are exposed to accidental needle sticks, and people living in regions with limited healthcare infrastructure. Addressing these risk factors through education and public health initiatives is critical for reducing the spread of HIV. In conclusion, HIV is a manageable chronic disease when diagnosed early and treated effectively. Understanding its etiology, recognizing risk factors, and adhering to antiretroviral therapy are key to preventing complications. Patients must also commit to lifestyle changes and routine monitoring to maintain their health and prevent transmission. Thank you so much.